Hello everyone. In the last video, we have discussed about chemotherapy and how whenever you use a chemical agent for therapeutic purposes, it is referred to as chemotherapy. This was the entire focus of the discussion. Today we will move ahead to understand a little more about chemotherapeutic agents and to be more specific, those agents which are utilized in perspective of treatment of different kinds of infections. But before we delve into understanding that, it's going to be very important for us to learn about two suffixes. Whenever you use static and cidal as suffixes for any antimicrobial agent, it makes a lot of difference to its meaning. So let us understand what these suffixes are all about, because they will denote the type of the antimicrobial agent and what does that agent exactly do. Whenever you use the suffix cidal or side, let me tell you that this suffix indicates that the agent will be able to kill the microorganism. So cidal is synonymous to killing. So if I use a term like germicide, it would basically means that it kills germs or it kills pathogens. Disease-causing infectious agents are being killed over here. But it also denotes that it may kill some non-pathogenic organisms also, but maybe not the spores of these organisms, just the cellular forms of these organisms. So cidal, this word, indicates that the organisms are being killed. But when you use the suffix static, it is indicating that it does not kill the microorganism, it just prevents the multiplication of the organism. So to make it clear once again, cidal stands for killing action, static stands for inhibition of multiplication of these organisms. So to make it more clear and understandable, let us take an example. When I use the term that an antimicrobial agent is bacteriostatic, it indicates that the agent can stop the multiplication of the bacteria, but it will not be able to kill them. It's just able to stop the multiplication. But when I use the term bactericidal, it will indicate that this agent has the capability to kill bacteria. So there are some chemical agents which are bacteriostatic, which can only inhibit the multiplication of bacteria. And then there are some agents which are bactericidal, which have the ability to kill the bacteria. Similarly, if I use a term fungistatic, it will indicate that this agent can stop the multiplication of fungi. But if I use the term fungicidal, it's an indication that fungi will be killed by this agent. So I hope static and cidal, this terminology is now a little clear to all of you. Let us now move ahead and discuss some basic types of chemotherapeutic agents. These types that we are going to discuss is on the basis of what the agent is capable of acting on. Which kind of microorganism can it act on? So on the basis of that, the chemotherapeutic agents are classified into 4 major categories. There are several other ways of classification. There could also be subtypes amongst this classification, but we are not getting into those details. We are trying to understand the basic classification mode. So to begin with, the first category that we have is of antibiotics. When a pre-course survey was run, this was one of the questions, that what can the antibiotics majorly act on? And majority of you have chosen that it can act on all kinds of microorganisms, but that's not true. Antibiotics are those chemical agents which can act against bacteria. They can act only on bacteria. So whenever you hear of antibiotics henceforth, please keep in mind that it cannot act against fungi, viruses, protozoa. Antibiotic, if is the term used, this chemical agent will be able to act against bacteria only. If you want an agent which is acting on fungi, the term that you then use is antifungal agent. If you're talking about agents which can act against viruses, then you're talking about antiviral agent. And if you're talking about agents that act against protozoa, then we are speaking of antiprotozoal agents. So these are the major categories of chemotherapeutic agents that we are prescribed on the basis of what infection are we suffering from. Please remember these terminologies because we have a tendency to interchangeably use these terms, which completely changes the meaning. And hence, understanding these terms and using the correct terms is very, very important. In the next video, we will try and understand how do these chemotherapeutic agents act. We will not be able to get into the technicalities because we have a wider audience over here. But the basic of how these agents act on the infectious agents is also important. So we will speak about that in our next video. Stay tuned.